Welcome back, everybody. Oftentimes we have our friends from Trinity Mother Frances on our program, and just recently especially, they're moving at the speed of light over there. I mean, they are creating more and more centers and programs and just tons of great stuff over there. Today is no different. They have just recently opened. In fact, their first patient was seen on Monday at the Trinity Mother Frances Epilepsy Center.
Certainly, a lot of these centers are new to East Texas. A lot of times we're used to going to Houston and Dallas for that. Registered nurse Ashley Lesniewski, I'm trying to say that correctly, is here to tell us about what does the new Epilepsy Center mean here for East Texans, people who live in Tyler, Longview areas like that.
Well, it means that you don't have to travel to go for treatment for epilepsy. Currently, or before Monday, the closest centers were in Dallas and in Houston, and going east to the eastern part of the United States, there are virtually none in the southeastern states. So it's really important for our patients here in East Texas and even in Louisiana and Arkansas to be able to come here for treatment.
Absolutely, and there are a lot of patients at that. You gave us some numbers just recently about how many people, in fact, across the U.S. and in the area are dealing with epilepsy.
Yeah, about 2 million people in the United States are diagnosed with epilepsy. So it's really important that we have specialized centers for these patients to come and be seen.
And we know that epilepsy is something that people deal with their entire lives, and they can live very healthy lives, but how important are these checkups for people that have epilepsy?
They're very important because you need to be seeing your physician so that he can follow your events. There are many medications available, but it's important to see your physician to make sure that those medications are working as they should. And that's when we see people actually in the Epilepsy Center, is when their medications are not working for them, and then we're trying to localize where their seizures are coming from and formulate a treatment plan.
Okay, now sort of to expand on that, what sort of treatments are you offering as far as that goes at the center?
So in the center we do a video EEG. So an EEG is electroencephalogram. So basically we're putting electrodes on the brain so that we can see on the head so that we can see the brain waves. Sure. So essentially we're monitoring them to see where their seizures are coming from so that we can determine what the next steps are for them.
Okay, Ashley, thank you so much for joining us and for telling us about this. Now, if you are trying to find out more about this epilepsy center that just opened up at Trinity Mother Frances, call that number on your screen or go to their website, tmfhc.org.
And again, you all are doing such great things over at Trinity Mother Frances. If people have questions about epilepsy specifically, how can they maybe get in contact with you?
They can go to our website and go to the Neuroscience Institute and find numbers there.
Okay, great. And again, something so many people across the nation are dealing with, and lots of questions. You all probably have lots of answers too.
We do. Thanks for having me.
Thank you so much for being here. Again, Trinity Mother Frances doing some great things over there. Ashley, we appreciate you being here.
Thank you.